Assalamu alaikum everybody, this is Umme Hani Khan and the topic for today is how digital phenotyping is used in the diagnosis of mental health problems. This is the list of contents that we're going to discuss later in this topic. Okay, so when we talk about mental health, it is not taken very seriously in most of the communities and societies, despite the fact that it affects 14% of the world's population, which is quite a lot. And in Pakistan, it accounts for 4% of the total disease burden. And despite that, we have a shortage of psychiatrists. Like we have 0.19 psychiatrists per 100,000 individuals, which is quite low. So mental health problems has been rising all around the world, especially after COVID. There, people are facing a lot of these mental health problems. When we talk about Pakistan, so people in Pakistan face constant daily life challenges, be it inflation, shortage of necessities, unemployment, uh, society pressure, study pressure, people are facing a lot of cyberbullying as well nowadays. So that basically leads them towards developing these mental health problems like depression, stress, anxiety, social anxiety, and that ultimately leads them towards suicidal attempts and suicidal thoughts. Still, mental health is still a taboo in Pakistan, and people don't really take this topic very seriously. They don't really like to talk about it. Basically, they don't even know that they're going through depression or any other kind of mental health problem. And that is one of the reasons why they remain undiagnosed. Another reason is that the help and the treatment is quite expensive. So people who actually wants to get themselves diagnosed, they can't because they cannot afford it. So we need to have a cost effective way to get ourselves diagnosed. And one way is digital phenotyping. So what is the digital phenotyping? This term digital phenotyping was coined by James and his colleagues in 2015. Phenotype, as we all know, are the observable traits of an individual. For example, your hair color or your eye color. Digital phenotyping, on the other hand, extend this concept into the digital area, where we collect the data from the digital devices, for example, your smartphones or your smartwatches, and then we analyze that data to get to know about a person's behavior and their mental state. The data that is collected could be your location, your app usage, your heart rate, your sleeping schedule, your call logs, and all the other things as well. This is some of the data that is collected through your devices. First of all, we have activity. So the rate of your activity is collected through accelerometer. The decrease or a reduce in the activity could indicate that a person might be suffering from depression or stress, while an irregular pattern could indicate mood disorder. Cognitive functions can be assessed through app usage, which would increase, while the engagement levels and the reaction time would reduce if a person is suffering from any kind of mental health problems such as schizophrenia or bipolar disorder. Mobility. Mobility basically indicates how socially active you are, and it could also indicate your routine and the change in your routine. So if you're isolating, you might be suffering from social anxiety. Sleep is very much related or linked to mental health problems, because if you have a poor sleeping schedule or an irregular sleeping schedule, you might be suffering from mental health problems. Socials again could indicate how socially active you are and a change in your communication habits. Then lastly, we have heart rate. A variability in your heart rate could be a sign of depression and stress. So how it works? Basically, first of all, we collect the data passively and actively. So passive data could be collected through your smartphones and your smart watches, basically your devices. And then active data is basically a questionnaire, which is filled by the patient that is getting diagnosed. Then we process that data. So the relevant data is identified and selected, while all the irrelevant or repeated data is cleaned out. Then the relevant data is analyzed using advanced algorithms to gain insight into the mental health. Okay, these are some of the advantages of using digital phenotyping in the mental health diagnosis. First of all, it helps in early diagnosis, which is very important for an early treatment because uh, if we get ourselves diagnosed in the later stages, it would cost us a lot for the treatments. Secondly, the data is continuously being monitored in real time, which would allow us to have an accurate tracking of your mental health over time. Third is that it is cost effective. So yes, it is cost effective, and you do not have to visit the clinics often to get yourself monitored and diagnosed. Accessible, fourth advantage is that it is accessible. So nowadays most of the people owns a smartphone, so it that makes it accessible to a broader number of people, and people who live in remote locations could also access the mental health services easily. Lastly, the data that is collected could be used to plan a treatment according to the individual's need. So making providing a more personalized care. So with the advantages, we have certain disadvantages as well. Firstly, we have the people would have privacy concerns, because they would be sharing their locations, their personal data. So they would be concerned about how their data is being used, it is being stored, and how well it is being protected. So it might be possible that people don't opt for this method because of the privacy concerns. Another disadvantage is that the reliability of the data could be questionable, because of the malfunctioning of the devices or any kind of human error. For example, someone might forget to carry or wear their device. Okay, so what could be the future directions of this technique? Um so I think that this technique is quite useful, and it is quite innovative for the diagnosis of mental health. So there should be further studies and advanced researches on this technique to address the limitations that it has currently. So, and by doing the research and further studies, we can improve its reliability, and also we can improve its accuracy. So yes, it is very important to further research and study this topic or study this technique. That is all. Thank you.